Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. Today's role plays for the doctors, and the setting is suburban general practice. In this role play, the doctor already knows the patient as the patient has come to get the result for the investigation. That is a barium meal test he had, and the doctor has to start the conversation by directly welcoming the patient. So the doctor may start, hello, Mr. David. How are you today? David will say that, Doctor, I'm a bit worried as I had my investigations 2 days back and I want to get my result. Doctor has to ask then, yes, David, I can understand your anxiety, but the results are not favorable. As you underwent barium meal test and it showed some ulcer on the lesser curve of the stomach, and we are suspecting this to be malignant. In this case, the patient will definitely become more anxious or worried. The doctor has to console the patient, convince the patient by saying, David, it is not sure that it is malignant, but to rule out this, it is at this time mandatory. I mean to say that we cannot leave it here. So that's the reason I would suggest you another test, that is gastroscopy. But before I could write this test for you, I would like to ask you a few questions. If you're comfortable, may I ask? Then David will definitely say, yes, doctor, you may ask me anything, but I just want to be in the good health. I want that I should get rid of the pain I'm having. Then, doctor, you should ask, David, can you please elaborate a bit more to me? When do you feel pain? So the patient will say that, doctor, I've been experiencing this pain for the last couple of days or couple of months, maybe. And the next question of the doctor could be that, David, can you please tell me what is the nature of the pain? So here, OET candidates, we have lots of vocabulary for the pain. I have made a short for that. You can go with this. It may be burning pain. It may be intermittent pain, regular pain. It may be sharp pain, dull pain. So in this way, we have lots of words to explain the pain. So in this case, the patient will say that it is piercing pain. I feel that there is something which is piercing and uh, I feel too much pain. Then the doctor will ask you ask then, David, can you please tell me that what time do you feel? Whether it is after taking food or when you're having empty stomach. In this case, the patient may say that, doctor, it's not sure. Sometimes I start feeling pain even at the empty stomach, and sometimes it is when I have taken my meals. And now I'm scared of even eating meals because all the time I feel this pain. Then the doctor has to ask more about this. So how does this pain subsides? So David, can you please tell me that do you get relief from the pain after taking some medicine or doing some activity? Then the patient may say that, yes, doctor, you suggested me some medicines. I take those painkillers. And after that, I take uh, some cold water or some milk. And then this pain is relieved. So the doctor has already given him some analgesics along with anti acids, so which may relieve his pain. But as the pain is persistent, it is indicating something serious. So the patient needs to undergo gastroscopy. And now, gastroscopy is to be explained how it is to be done. You have to tell that it is a small procedure, and the by the camera, his internal stomach that will be seen. So it will take hardly half an hour to go with gastroscopy, and the patient may say that, doctor, is it painful? Then the doctor may say that, no, it will be done under anesthesia and you will not feel any pain at that time. But it is important for you that you have to go empty stomach. Do not eat anything 10 hours prior to the test. So then find out what information about the condition the patient. Try to reassure the patient mentioning other possible non-malignant causes, that is ulcer and indigestion. Now, one thing was left, that is to be asked by the patient, by the doctor. David, can you please tell me that do you feel that your food remains undigested? Or I meant to say that how do you feel about food which you have taken, say, 2 hours prior? So do you feel that the food gets properly digested, or do you feel indigestion? The patient may say that, doctor, I feel that sometimes it is indigestion and I have too much flatulence also. So now, by ending this topic, the doctor has to tell that, David, till the time we are not going with the gastroscopy, I'm not able to explain. Yes, I'm not showing you that it is malignancy, but we are suspecting this. To rule out this, it is necessary at that time. Because if it is ignored, it may lead to some unpleasant consequences. But to be on the safer side, we are going with the test which will definitely indicate us, and we will be able to make a definitive diagnosis from your condition. Now, this is not sure that it would be malignancy. It can be other causes like ulcers. Sometimes when there's ulcer, peptic or ulcer, duodenal ulcer, in that case also the patient has similar pain. But the treatment is much required at this time. Secondly, it may be indigestion. When indigestion is there, even then there is excess acid produced, and that may irritate your stomach. So if it is not done at this time, if it is not treated at this time, in that case, it may lead to serious consequences afterwards, which may not be controlled. So that is the reason this is my strong recommendations for you to undergo gastroscopy right now, and do not delay it. I'm writing this investigation for you. You can go to the lab and get it done by tomorrow. So I have talked to gastroenterologist, Dr. Smith. He will perform this, and he'll help you here to get your test done. So, David, I'm going to set an appointment with you after 2 days. Bring the results of gastroscopy, and then we can proceed further. Hope that it should not be malignant, but if it is malignant, even then you should not get worried about, because if it will be in the initial stage, we can find out the solutions, and hopefully you will be cured after getting the proper treatment. But at this time, it is important to undergo this test and find out the reason, or the rule out what was the cause for your consistent pain in epigastrium. So in this way, you can end up the topic. Hope this topic will be helpful for you in the exam. And if you like our video, do not forget to like and share it with your friends and colleagues. And if you have not subscribed our channel yet, please subscribe it right now, so that you should be able to get the latest updates on our channel. Whenever we are uploading any new video, you should be getting the indication for that. Thanks for watching. Stay connected. Happy learning. See you soon with a new video. Thank you so much.